The number of people who have tested positive for COVID-19 keeps rising in the province of Ontario. However, the number listed as recovered hasn't budged much at all. But one of our own from the agenda is hoping to join that list shortly. Producer Patricia Kozicka tested positive earlier this month, and she joins us now via Skype from her home in Toronto. Trish, how you doing?
Hi, Steve. Better. How have you been?
Well, I haven't been COVID-19 positive, and you have been, which is why I'm asking
Yes.
you how you're doing. Are you feeling
Yes.
all better now?
Much better. It's been an interesting couple of weeks, obviously. I'm still not fully recovered. I was told that I'm supposed to wait until I'm absolutely symptom-free for 48 hours, which still hasn't happened, but waiting for the day for sure.
Good. When did you, at what point, notice something was off in your health?
It was actually the day before my birthday, March 16th, 14 days from today, where I started to get a mild cough. I was at a cottage that my husband had rented for my birthday with another couple. And, as soon as everybody hears the cough, there's this collective, uh-oh, because everybody is just worried. There had been so much coverage of it. And, as soon as you hear it, you wonder, does this mean that I now have it? And then the next day was my actual birthday. I woke up, I slept in way later than usual. I just felt like my whole body hurt. I had a massive headache. I didn't really have much of an appetite. I ended up going back to bed where I spent, the whole day under covers, feeling chills, fever, and just not great, basically. And then
So
the next day, yep.
when it came on hard then, right? Like it
It
really
came on
attacked
really
you.
hard. The second day, it just knocked me right out. I had no energy whatsoever. And that was kind of the most pervasive symptom for me, was just the lack of energy, the weakness, the fatigue. It really, really took a toll on me over the coming days as well. Even when we came back into the city, I would just be sleeping for the majority of the day. There was a point where, I thought, we have so much food, but my husband and I had almost no energy to actually make the food that we had purchased for ourselves before all of this began. So that is my one piece of advice, to just have maybe some food in the freezer that you can just warm up if this does happen to you, because chances are that you will be feeling quite weak, quite tired as well.
So did I hear right? Is your birthday in the middle of March?
Yes, it is St. Patrick's
So
Day.
your
Definitely a
birthday,
birthday to remember.
your birthday is the Ides of March. That's not a good day.
March
As history
17th.
has, oh, 17th. Okay, you're a little
Yes.
further away then. Okay, now you
Yeah.
mentioned your husband Olivier. Did he get this as well?
He did. His case was a little bit different in the sense that he didn't really have much of a cough. For him, it started a little bit earlier with a bit of a sore throat. But same thing in terms of really bad body aches. Everything was just hurting. He had fever for longer, and he had really, really bad headaches as well.
Now, did you both suspect that you were COVID-19 positive?
We did, just because, you've been hearing all of the symptoms and we checked a lot of the boxes. We had also been in contact with somebody who had come back from the US and didn't self-isolate. So in the back of my mind, I suspected that I had it. But then as I progressed through the process, I realized I had been in contact with somebody else whose husband's coworker had tested positive. And I realized it is just more widespread than we realized even at that point. And because there has been an inability to test as much as perhaps many would like, we're just not at that level. We have no idea how many people are actually affected.
So do you know categorically who or where you got this from?
I was told that unfortunately there's no way of knowing for sure. It's just there's spread in the community, and even people who don't have symptoms might be spreading it. So it's truly impossible to know. I mean, I was taking the subway, I was grocery shopping with everybody else, facing barren shelves. So it really could have happened anywhere. It's impossible to be able to tell.
Did you get tested so that you conclusively knew your diagnosis?
I did. Initially, well, I tried to call telehealth. I wasn't able to get through. I called my family doctor's office. I was told initially just to self-isolate, but then I did start experiencing some shortness of breath. And so I contacted the Women's College Hospital, and I filled out the assessment form that they have online. A doctor calls you back, asks you more questions. And based on that discussion, I was told that I could come in for a test. My husband went through the same process. He was told just to keep self-isolating. And so on a Saturday, this was 6 days after coming down with the first symptoms, I looked up how far the hospital was. It was a 40-minute walk, which based on my energy levels, I just didn't have the confidence that I would be able to walk that far. So I didn't want to, of course, take an Uber or transit because I didn't want to take the chance of infecting anybody. So the only option available to me, because we don't have a car, was to just hop on my bike and take a 15-minute ride to the hospital. I had
You
put
are
a
kidding
scarf
me.
on. No. You got to do what you got to
cycled to the
sometimes.
hospital.
I did.
You
I had
cycled to
no
the
other
hospital.
choice. I did. I'm a trooper. But, and I was expecting that I would be standing in line for hours despite having gone through the pre-screening process. And much to my surprise, there was absolutely nobody there. There were two separate doors. One was for people who hadn't gone through the assessment process. And there was another door that for people like me who had received a hospital fast track ID. And it was just emptiness. There were signs along the hospital wall for people to stand 2 meters apart, but I was the only person there. And so from the time that I arrived, they made me sanitize my hands, put a mask on. They did the swab with a huge, what looks like a huge Q-tip that they stick as far in as they possibly can.
Okay,
and
hang on. Let me find out more about that, because I've heard Vice
Yes.
President Mike Pence describe that as a very so they take that long Q-tip and they stick it right up your sinuses. Is that what they do?
They do. They just did one nostril for me. I know some people who get tested get two, depending on where you are, it sounds like. But they warn you that it's not going to be pleasant, and it wasn't. They just make you put your mask down so that your mouth is still covered, so in case you cough, you don't infect them. Even though they're covered from head to toe, they have the mask, the visor, the booties, everything. It's like something you've only seen in films. They tip your head back, they stick it in, and it's going so far, and you can feel your eyes welling a little bit as they're just like sticking and turning. And I just remember making little fists out of my hands because it was so uncomfortable, but it's over pretty fast. I mean, like I said, from the time that I arrived to the time I was all done, it was 6 minutes.
Okay, well, that's pretty quick. All right, in our last minute then, Trish, tell me this. We keep saying this to younger people, or everybody keeps saying it to younger people who think they're invulnerable and, of course, can't contract it. And there's too many young people who think this is an older person's problem. What does your experience tell you about that old wives' tale?
Honestly, it frustrates me so much because I feel that people aren't taking this seriously. We've seen reports even from this weekend of people out and about, definitely not social distancing. I know people who have had symptoms who were supposed to be self-isolating. They haven't been doing that. I even have a family member with whom my grandmother lives who's also not taking this as seriously as our family would like. And so it's deeply, deeply concerning because my case was a very mild one. I feel extremely fortunate that it wasn't worse, that I'm not one of those many people who do require a ventilator, but others won't be so lucky. And by going out, by not following what we've been asked to do, which is to physically distance, to stay at home, we are putting vulnerable people's lives at risk. And it's just not worth it. I'm just begging for people to just stop being selfish and to stay at home.
Good advice. It's good to see you doing so much better, and we look forward to seeing you back at the shop once this thing is all over and we can actually go back to work. You stay well, okay?
Me too. Thanks, Steve.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.